That's the first thing to say. It does feel just a blink of an eye that we're here this time last sort of year, but I think we all feel that we're in a much, much better place now, thanks to the sort of vaccination sort of program, thanks to the incredible sort of work that has happened over the district in the intervening sort of time. We've definitely got a rocky few weeks ahead, and that's what this meeting is about. How can we all work together to really mitigate the impact of Omicron over these next sort of a few weeks and months, so we can then enjoy all of the hard work that's happened in really getting the pandemic under control. So it's really fantastic today to be joined with an amazing colleague of mine, Professor Kath Noakes, who really is a world expert on ventilation, will really give us some practical information on how we can help to make schools safer for children and staff. So we're not going to wait around, as I said, for any further people joining us. We're just going to start proceeding. So I'm going to hand straight over to Duncan, who's going to give us the latest from public health.
Hi, thanks, Mark. Hello, everyone. Happy New Year as well from me. So we've got 20 minutes on the agenda, but it probably won't take that long. And myself and Martin Hammond from Children's Services within the council are just going to give you sort of an update, really, of what's happening around the country, Bradford, and then Martin will deal with some of the specific questions within schools. So as ever, we will try and answer all your questions. Things are changing very, very rapidly. So if we can't answer them all today, we'll certainly get a reasonable answer back to you within the next couple of days. Okay, so everyone, so to start with, just to give you the national picture on Omicron, on which is a sort of less severe variant of COVID, is that it's peaked now in terms of the whole country. The numbers of cases are starting to come down. Hospital admissions are starting to plateau off, and we haven't seen a significant increase in deaths. So that is some good news on the horizon. We seem to be about 7 to 10 days behind London. So cases are still going up in Bradford, but the last 2 or 3 days, and I do keep a close eye on the data, it looks like it's starting to peak in Bradford as well. So what I think we will have with Omicron is we might have quite a slow decline because kids have just gone back to school and they've still only been back really about a week and a half. But I think it will start to go down in Bradford soon. So I think we're probably at the peak point of disruption at the moment, if that makes you feel any better at all. But I know it must be really, really difficult at the moment. So in terms of the rates, we're getting about 1,800 cases of COVID that we know about in Bradford District. There's probably at least 4 to 5 times that amount of people that aren't testing or we aren't finding out about. In terms of how it's affecting preschool and then through the key stages, the overall rate for Bradford, to give you a few statistics, is 1,800 per 100,000. For the 0 to 4 years, it's 590. 100,000. For 5 to 9s, it's 1,080. Carries on going up, I'm afraid. For 10 to 15s, it's 1,600. And for 15 to 19-year-olds, it's 2,200. So it's unprecedentedly high rates of infection, both in young adults and in children. And what we're seeing now is the primary and secondary ages starting to rise, and they've doubled in the last week. They've followed the rise in adults. So hospitals are really busy, but less people are going into intensive care, which is good news. Most of the busyness, to be honest, in hospital and the pressure has been around the usual winter surge combined with COVID, and it's not really COVID. In terms of what's happening in Europe, because we've had a few questions, and I know some of you will have school trips booked and things like that. The description from the EU director for Europe is that Omicron is going east like a huge army through Europe. So to give you an idea, so if you've got skiing trips, I know there's not huge amounts of skiing trips that get planned across Bradford District, but I know that some of you might be thinking about trips to Italy and France and so on. I would just check your insurance very, very, very carefully at the moment. So in England, we have about 150,000 cases a day. France this week recorded 370,000 cases in one day. So it's really, really taking off there. And you'll have heard President Mitterrand's stance on this. It's quite hard. And Italy as well is another area that's got over 200,000 cases a day. So I think that it's quite perilous booking trips at the moment. So I'd really, really sort of check your insurance. As I said, that would be my advice on that one. In terms of the other bit of new guidance, you've seen on the news today, the isolation period's been reduced from 7 days to 5 days. So previously, if you had a lateral flow test that was negative on days 6 and 7, you could come back to school. From Monday, we believe that is going to change to having a lateral flow test that's negative on days 4 and 5, so you can come back to work on day 6. So what that would mean to you for next week would be if you're positive on Wednesday, Thursday's day 1, Monday's day 5, and then you're back to work on Tuesday. So everything's going to be taken within a week. So hopefully that'll ease a bit of the pressure and getting some of the staff back to work a little bit easier, a bit earlier. The other bit of advice as well is to make sure, and it's worth telling your staff, if they're going to take Lefties and they're isolating because of COVID or contacts, take them early in the morning, because then you can get that 24-hour period in before work and still go to work on the same day. So if you take, I know you all get up really early as teachers, so if you just take them as soon as you get up, that really is the best thing to do. Okay, so that's the first thing I wanted to update on. The second bit is some of the conflicting guidance around this confusing 90-day period. Should you or shouldn't you be testing within 90 days after COVID? Myself, Martin Hannon, and also George, my colleague from Brazil, who you might remember from previous discussions, is very good on this sort of stuff. I've been looking at the guidance, and unfortunately there's contradictions between all sorts of bits of guidance on the internet that come out of the DfE and the governance. So out of the government. So what we've tried to do is just have a sort of really common sense and simple approach, really, that we can advise you on. As you know, the DfE have advised that somebody who's tested positive for COVID-19 within the last 90 days are encouraged to take part in a lateral flow test and sort of the regular testing for school, but not a PCR test for 90 days. And I think that's the general rule. So if you have a positive PCR or an LFD test, avoid PCR tests for 90 days, but wait till you come back to work and then rejoin the LFD testing. That's the simplest way that we can describe it. So avoid PCRs for 90 days, but engage again in the LFD testing. And we'll put a line on the Bradford Schools online public health pages just so to make that really, really clear. There is a grey period. So people have said, well, what if I test negative twice and then I test positive 2 days later? Our informal advice for you is to leave it a week afterwards. If you've got 2 negative lateral flow tests, you shouldn't be infectious. It'd be very unusual if you're infectious. So come back to work and leave it a week before you enter the testing programme again. Face coverings, as you know, have come back in again this term in secondary schools. We will support you on your decisions around this. We haven't got any information ahead of the later in January when we're expecting another government announcement whether they progress this. You know best whether face coverings are making an impact and are effective within your secondary schools. It's just one of a series of measures that you've got in terms of ventilation, testing, face coverings, limiting the numbers of kids in bubbles and classrooms and so on. You will have a much better idea. It's almost like you're tuning all these different dials on a complicated machine, and you'll have a better idea about how that affects COVID in these sorts of Omicron. So we'll leave that up to you about if you want to continue to use face coverings, we will support you from public health with that as an effective public health measure, because the evidence gets strong, although some of it's a bit difficult to interpret. The international evidence about areas that have introduced face coverings against those that haven't is that it is effective in reducing overall infection levels in communities. And then the final thing really is around vaccination. Secondary schools would have received information from the vaccination teams. They are doing a second sweep around secondaries during January. I realise it's difficult getting parents to consent and provide that information. It is effective. We've heard from head teachers that have taken that quite hands-on approach in phoning up individual families and trying to persuade them that it's really important their child gets vaccinated, and that is effective, but I realise that that's very labour intensive for you and your staff as well. So they'll be visiting. The vaccination rates for the 12 to 15-year-olds for Bradford districts, it's only 36%, so we've still only got about a third of our young people vaccinated for the first dose, so it's worth encouraging that in any way you can as well. In terms of whether the government are going to be bringing in vaccination for primary school age, we're still waiting for the evidence on that. There hasn't been any decision on that, so I'm not sure. But the way things are looking, the messaging that we're getting in the national proclamations now is that we're trying to move into a post-COVID period. So I think it would be unusual if there was blanket vaccination of 5 to 11-year-olds. But please remember that any child in a primary school who's clinically vulnerable or lives within a family with an immunosuppressed adult is entitled to a COVID vaccination as well. So 5 to 11-year-olds in those categories will be vaccinated. So that's it. That's it from me. All I'll say is to you, it's a sad day for me because Jonathan Van Tam, who you might remember from the telly, he's the deputy CMO who gets on and makes all these amazing analogies about football and yogurt and things like that. He's stepping down today, and he's one of my public health heroes. And one of his analogies was that COVID was like the Grand National. So we're all battered and bruised, but we're probably getting to the last 2 or 3 fences now. I know you've heard that before, but I do get a sense that we will be moving out of this towards summer, and things are going to get slightly easier for you all. So I'm full of admiration for the way that you cope with all these waves of Omicron and sort of keep going. I think we're nearly out of the woods with this one. So what I'll do now is I'll hand over to Martin, who's going to just sort of tackle some of the more on the ground issues within school.
Okay, thanks, Duncan. Hope everyone can hear me. Somebody give me a wave just so that I know that, yes, thank you. Brilliant, thank you. I've turned the video off because it freezes often, and I can't think of anything worse for you guys than to have a look at a frozen face of me for 5 minutes. Duncan used the word unprecedented. I'll use the word bonkers. Because as someone just put in the chat, there are the highest numbers that we have seen at all at any stage of the pandemic in primary schools, in staff, secondary schools, everywhere. There are more cases being reported on a daily basis than ever before. Having said that, I haven't detected any sense of panic from you brilliant head teachers, staff in schools. I just detect a calm resolution, or you might even say resignation to the situation in face of the huge numbers. So long may that continue. Let me just remind everybody that that I'm here to support you, right? And I have access to Duncan, George, and all the rest of the team, so the public health team. So if you need anything at all, if you want advice, guidance, support, somebody to rant at, a shoulder to cry on, then please contact me directly, and I'll do my best to support you. So it seems like no sooner has the guidance just started to settle down and people getting their heads around it, then we have some new guidance which will be coming out starting on Monday. I'll start straight away by saying, other than the same BBC report that you guys have all read, we don't know any different. So we don't know when it's going to start as such, and we don't know any of the details as such. Hopefully, some poor soul is busy writing guidance as we speak. It wasn't updated as of 10 minutes or so ago. So first question, most common question this week is it too early to have a drink yet? And apparently you can have drinks at work, so that seems fine. No, most importantly is to PCR or not PCR? I see someone's put a question about that in the chat. So the simplest way to approach that is to think of this. If there are symptoms, then you go for a PCR. If a child shows symptoms, they go for a PCR. Member of staff with symptoms, go for a PCR. And this, remember, is as of Tuesday this week. If you have symptoms and you have taken a lateral flow test, then you do not need to go for the PCR to confirm it. There seems little point in that. You shouldn't really have taken a lateral flow test if you had symptoms, but that was a question that came up this week. The big change that caused a little bit of confusion is asymptomatic. So if you have no symptoms, child has no symptoms and takes a lateral flow test, they no longer need to go for the confirmation via a PCR. They just self-isolate immediately and then go into the 10 days of self-isolation where you can be released if you test negative on day 6 and day 7 currently. We're going to wait to see, obviously, what that means in terms of testing. I think I've read that means that those 2 tests will come earlier, which will be day 5 and day 6 to be released. What it means is that you need 2 consecutive lateral flow tests which are negative. They must be taken 24 hours apart. And the advice that we've given for day 6 and day 7 this week is probably the one that we will give for day 5 and 6, which is if you want your member of staff or your child to come back after day 5, that they will need to do their first test early on day 5, the next one on day 6 very early, so that then if it's negative, they can get themselves to school or return to work. So you couldn't, for example, do one late on one day and the next test early on another morning because they're not 24 hours apart. So that's the top tip on that part. In terms of unvaccinated people, I haven't read anything different to that at the moment. So as far as I know, Duncan might know something different, although he rarely does because we both read the same media reports. The unvaccinated people as contacts will still be required to isolate for 10 days. So whether that will change or not, because that I know is a bit of a bugbear for lots of you. Next top question really has been, when is day one? Duncan just mentioned that now. If you have symptoms or you have a positive test, that's day 0. Next day is day 1. Then of course you can be released on day 6, 7, etc. If you continue to test one of those tests positive, then the guidance says that you will need to do 2 days of consecutive negative testing. I'm assuming that that will still continue unless you get to the full 10 days, in which case you can be released at that point. There was a long discussion about whether you're still testing positive means that you're still infectious, but that point seems to be rapidly losing any credence at the moment. In terms of your outbreak management plan, I would just ask everyone to make sure that they've had a look at it again since the return from Christmas. Certainly in terms of the highly infectious nature of Omicron, it appears that you just have to look at someone and you can pass on the virus at the moment. It does seem to go so quickly amongst people. We don't offer any global advice. So we don't say to all of our schools, you must all do X, Y, or Z. We do that because we're able to offer bespoke individual advice on your particular circumstances and your particular school. So that means that if you contact us, we can offer you the right route for your school and through. So and again, as ever, please give me a ring if you need any advice. I'll put my phone number in the chat in a moment. I would say 2 things, however, in terms of that. Number 1 is over the next couple of weeks, I would prepare for at least 10% of your staff being off on a daily basis. I would mention a couple of our schools have got almost 50% at the moment. So prepare for at least 10% of your staff being off. What would you do? How would you manage? How would you get your remote learning up and running very quickly? If you haven't already thought of that, please make sure that you do that. And the second thing is, unless all of your SLT have already had the virus, and I know that's quite a lot of you, just think about how you can work to ensure that should the worst comes to the worst, all of your SLT don't go down with COVID at the same time. That's happened to a couple of our schools and has caused some consternation, shall we say, certainly amongst head teachers who were thinking, who's actually going to run my school? So just be wary if you're having SLT meetings. Stick to the advice of ventilation, and maybe just keep one person out of that meeting and let them access remotely just in case. So I'll leave that one there. In terms of vaccinations, Dunk's mentioned that. So you should have had contact from the school vaccination service for secondary colleagues. Any issues with that, you should have the contact address for Psyche Causa, if you can go straight to her. Or if you can't find any of that, just come straight to me and I'll try and sort that out. Let me just have a quick look through the chat and have a look at some of the questions. I think it's fair to say that some people are not completely positive about the changes. How many cases do they have to be in a class of 30 for it considered to be an outbreak? This is Katie, thank you. I guess way back in September, Katie, when we started all of this, the government put a figure of 5 on, didn't they? If there were 5 linked cases. I think they rapidly understood that as soon as you put a number on something, when you reach that number, that schools probably quite rightly expect something to happen, like a SWAT team to arrive or something. So we've not really taken that number as an absolute. If you have rising number of cases, if you're worried about the number, it could be 5. There's also the 10% part. If you think that things are increasing quickly, then talk to us straight away and we'll see what we can do to help you manage the situation as best you can. For some schools, that's quite a significant number. If you've got 2,000 in school, 10% is obviously quite a lot of cases. Some schools are at that point. But there's no specific number is the answer to your question, Katie. So just contact us and we'll help you the best we can. I will get out any information that I can if it's published in Sue's email tomorrow to head teachers, so look out for that, but no doubt you'll be getting information from your professional associations as well, which will be sent, no doubt, of the other one. So last thing that I'll say is, many of you know I used to be a head teacher, so I feel like I'm doing a staff briefing, and once you've been a head teacher, you can't stop being one. So I would just finish by saying, when I was a kid, one of my favourite programmes was a police programme called Hill Street Blues, that some of you might remember. And the desk sergeant at the end of that, as he sent his colleagues out onto the streets of New York, would always say to them this, which was, let's be careful out there. So I would say to all of you, please look after each other, look after your staff. It's a really difficult time at the moment. Make sure that you're checking in with each other and take some time to look after each other. And particularly a plea for heads who maybe have not done this already. We've had some reports that heads have told me about new staff, newly qualified teachers, young staff, who've maybe only ever taught during a pandemic and are thinking about leaving the profession, which would be desperately sad. Please check in with them, make sure they're all right, remind them that it's not normal what they're doing at the moment. There was a time when you could teach all of your children in the class all of the time. So hopefully we'll get back to a point like that shortly. Okay, so that's it from me. I'll pop my number in the chat now. If you need me, just give me a call. Thanks.
Fantastic, Martin. I think Duncan's going to pick up a couple of the questions that weren't covered. And then I think there's a couple that will be particularly suitable for Kath. So let's go over to Duncan and then we'll bring Kath in.
There was one around why aren't we bringing a vaccination programme from 5 to 11s? I mean, I can put the link to the chat in, but the Joint Committee on Vaccination and Immunisation consider all vaccinations. They consider the harms and the benefits of vaccination, and then they make the decision. And at the moment, they think the harms of the vaccinations 5 to 11s in the UK outweigh the benefits. And the sort of evidence that they cite is that no vaccination is 100% safe. So the COVID vaccines can cause myocarditis, which is inflammation of the heart. That's very rare, but serious infections with children caused by outbreak as well is very rare as well. So they're considering those harms of the vaccine in that age group as well as the benefits, plus the fact that they consider that a really large proportion of 5 to 11-year-olds already have antibodies to COVID, because such a big proportion of them will have had COVID or had COVID without symptoms. So that's the decision they've made. I know it's different in other countries, you know, Italy and the US and so on have brought in those vaccination programs. That is the decision of our Joint Committee on Vaccine and Immunisation. They don't consider the wider societal benefits, and there's been a bit of an argument around this because they've said that our remit is to consider just that age group and not the wider societal benefits. So that is the decision that they've made at the moment, I'm afraid. If you want to have a look at the fors and against, we can send you the information, but I can't really give you any more information on that one, I'm afraid. Was there anything more on that? I think the ones around CO monitoring and classroom ventilation, I'll leave to Kath, who knows a lot more about this than I do.
Okay, well, that's a really nice sort of segue over to sort of Kath. We'll double check and make sure we're not missing any sort of questions there. But Kath, there is a specific question here about the availability of carbon dioxide monitoring. There's been a request whether an expert can come out to schools to advise on sort of our ventilation. Clearly, the most powerful sort of tool that we have available right now for sort of schools is around sort of our ventilation. It would be lovely to hear your advice and sort of guidance. It clearly is a complicated sort of area, but if we can hand over to you now, that'd be wonderful.
Perfect. I've got a few slides to explain ventilation. If I can make this work, that is that one, hopefully. So I hope you can see that on the screen. Yep, that working, brilliant. Okay, so I thought I'd give you a bit of a heads around ventilation. What do we mean by carbon dioxide monitoring? Some stuff about air cleaners, and then we can have a few Q&A on that. So I can make the slides actually work. So I think it's first useful to start by saying, how does this thing transmit? And I think a lot of people kind of know this now, but it's actually pretty complex. So basically it's transmitted because of virus being carried in droplets and aerosols that we breathe out. When we breathe them out, we can just breathe out. We get more when we talk, when we sing, when we do sort of louder activities. And it's what you find is that very close to people, you get a much higher concentration of this virus. You get all different sizes of droplets, really big ones and some very small ones. But further away, what you get is the smaller ones that can get dispersed in the air. And if you have poor ventilation, you get more of those build up in the air over longer distances. But we basically, over time, we started off thinking that a lot of this was on surfaces and hands, and touching your face was all the important bit. Actually, now really the evidence says just about, probably 95% of the transmission is through inhaling those aerosols, and that the highest risk is when you're very close to somebody who's infected. But if you're sharing a room, then you can also get infected. So when it comes to ventilation is no magic bullet. We have to remember it's one measure that we apply together with other things. Ventilation is most effective against those what we call a long range airborne. And that's, you're in the same room, but you're more than sort of 1 to 2 meters away from the person. Okay. Probably doesn't do very much for surfaces. It might stop a little bit, but it really doesn't impact it. But surfaces are quite a small factor in this anyway. Keeping your hands clean is still a good idea though, especially kids in schools. And it has quite a small effect on this close range. So if kids are interacting very closely together, the ventilation is not going to solve that. It won't completely get rid of all your cases. It's no magic bullet, but it can actually reduce the amount that you get and reduce the number of outbreaks and cases in there. And I say it's no magic bullet. Sometimes you might get somebody who's so infectious that it doesn't matter that the ventilation is good. They can still get people. But on average, we know that ventilation brings it down. Say this close range, one of the reasons for masks work so well is because it actually mitigates this close range transmission. So that mask actually stops somebody releasing aerosols or reduces the amount they release, and it also limits what somebody else breathes in. Okay, how do we know? So we know this from lots of different things. We know it from the basic physics of how transmission happens and how aerosols move inside a room. We know it from outbreaks. So actually the picture on the right is a simulation of an outbreak in a restaurant in China. But we know that we get these big super spreading outbreaks. We also know that we get cases in some controlled places like quarantine hotels, and you can eliminate all the other routes and you're left with just the air. And then we know that if we do use models, we can say that ventilation, it's not the magic bullet, but it allows us to assess why it matters and give us sort of a practical balance between good ventilation and you can't blow a gale through the room continuously. We also know, I think this is really important, that the ventilation matters for other things too. So there's a big focus on COVID, but actually, if you've got a good indoor environment, you've got good air quality, it's helpful for your sleep, for your productivity, for your performance, for kids test scores. There's data on that. There's data on absenteeism with better ventilation things. So I think there's a longer term question in here. So yeah, it makes it safer, it makes it healthier, but it's not a magic bullet. Omicron. So we know Omicron's more transmissible. We can see that there's loads of different factors and we don't know which ones are the most important yet. When you get something new, users sort of scrabble to look at the data, really hard to work it out. We know that we have what we call a shorter generation time. That means the time from one person to infect another person is shorter. So it just means everything happens faster than before. We know that actually there seems to be some data that says it's better in the upper airway cells, and that might mean that it's showing up more as cold-like symptoms rather than the conventional fever and loss of taste and smell. It may mean that it gets released more readily when people sneeze or cough, for example. And of course, we know that the big challenge with Omicron is that we had this vaccine escape. We had to go through a booster program to bring people's immunity back up. It was a bit like going back to March 2020 because suddenly you've lost all that immunity from the vaccines. And say symptoms, it does look like, if you look at things like the Zoe app and things, that the symptoms are much more like cold-like rather than the conventional symptoms. We know that there's lots of data which says we've got higher secondary attack rates. So households, you've got more cases of it. There are some very big super spreading events been reported, but some of that is a timing issue. So it happened because we released lots of measures. People were having Christmas parties. You've got 150 people in one restaurant together all evening with no masks on, and winter with the windows shut. Whether that's Omicron or whether that's just because they all partied is a different reason. We have been looking to see whether there's a higher risk of aerosol transmission. It's possible, very uncertain, so difficult to say. But I think the evidence at the moment says aerosols are important, therefore ventilation is important. Okay, so what do you do with ventilation? So in terms of assessing ventilation in school, there's some very basic checks. Almost just go around and look, how does air get in and out of a room? Has it got a window? Has it not got a window? What sort of ventilation's in there? There's different types of ventilation. A lot of people are a bit suspicious of mechanical ventilation. Some schools, some of your schools will probably have ventilation. They might have something that looks like this on the grills, on the ceiling. They might have things on walls. Usually schools which are mechanically ventilated have some organisation who manages the buildings and knows that. So your site manager should know what you've got, and they can give you, or whichever organisation is, can give you some advice on what that system does and what they can do to that system. For most of you though, you will probably have natural ventilation. So that's opening windows. And really the first step here is, what can you do? Can you open them? Are they blocked? Are they inaccessible? And I know that some of them have restrictors on for safety, and safety and safeguarding hasn't gone away. We have to respect that. But there are some windows which could be maintained in a different way or made more easily accessible. And then some schools have these funny units called hybrid passive units. If you do have those, they are a little bit different. They do a sort of combination of mechanical and natural ventilation. Again, talk to your site manager and ask about what those systems do and how we can make sure they're operating as best they can. Lots of talk about CO2. So why do we measure CO2? Well, we all breathe it out. We breathe it out at a much higher concentration that's naturally present in the air. So it basically tells us, if you find it in the air in a classroom, it tells us the proportion of the air that has been breathed by other people, rebreathed air. Doesn't work in every room. So if you do it in your science lab, you'll get higher levels if you've got Bunsen burners running, because Bunsen burners generate CO2. So just watch, have you got another CO2 source in there? But the vast majority of classrooms, apart from perhaps some science and DT or similar type labs, won't have. CO2 doesn't just tell you about ventilation though. So the more people you have in a room, the more CO2 you get, because you've got more people breathing it out. If you've got people who are more active, they also breathe out more CO2. It's actually related to your metabolic rate. So the more if you exercise more, you breathe out more CO2. But it is marker of ventilation. So the higher the ventilation rate, the more the CO2 level decreases. Okay, so it's a useful proxy, tells us about ventilation, tells us about occupancy and activity. It isn't a direct indicator of infection risk, though. It's really important to remember that CO2 does not, high CO2 does not mean high infection risk, or low CO2 doesn't. It's related, but it's not a direct indicator. It's an indirect indicator. So it's telling us something about the ventilation. Okay, so lots of people got CO2 monitors. What do they mean? Okay, so don't get too hung up on the numbers, but typically if you've got a CO2 monitor and it's saying 800 parts per million, 850, something like that or less, don't worry, ventilation's absolutely fine. Keep doing what you're doing, absolutely brilliant. Don't think about it much more. If it's above 1500 parts per million and regularly above that, occasionally you get spikes. There's all sorts of reasons you get a spike. Kids have done PE and they come in and breathe in a bit harder for half an hour. But if you get that regularly, it's sustained over 1500 parts per million, there's likely to be a problem. Okay, so that means that needs a bit more investigation. You need to look at why, and there might be a problem there. Those are the spaces you want to really prioritize change action on. If it's between the two, then you want to try and improve things. So that's a real signal of, let's see if we can increase the ventilation, open the windows more, do something different in that room to try and reduce it. Okay, again, don't be too concerned if it's under 1,000. The difference between 800 and 1,000 sounds big. It's not in the grand scheme of things with CO2, because you can get those different numbers. You'll see them different days, different those variations. I think it's just trying to get it on the lower side rather than sticking at that higher side all the time. Okay, how do you use them? So I say the numbers are not a guide. Don't get too hung up on an exact number. They are they're not an exact measurement at all, and you can see this. You put a sensor in a different place, you'll get a different answer, and it's affected by lots of things. So the local environment affects it. So some places have higher outdoor levels of CO2 than others. If somebody's got a fire nearby, you'll get really high CO2 levels because of that. Different sensors have different levels of accuracy, and so don't be a slave to the numbers. If you move it around the room, activity changes, you'll get different answers. Thinking about where to put them, pragmatic bits come into it, but ideally you want it at the height where the occupants are-ish. Keep them away from the doors and the windows. If you put them right by the window, all you're doing is measuring the outside air rather than the inside air. Keep them away from the ventilation doors. Don't put them too close to people. They're within a metre or so of people. You're measuring what they're breathing out rather than the room. And play with them. If you've got sensors, have a go with them. Look at what happens. Get the kids to do a bit of activity. See if it goes up. Open with different windows. See if it goes down. Look at how it changes on different days. It will change with the weather. So the wind if it's a windy day, you'll get a different answer than if it's a still day. Have a play about with it and see if you can. A lot of people, you sort of learn how your environment works. It's really hard to explain it, but unless you've sort of played with one for a bit, and I know you don't have a lot of time for these, but if you can keep an eye on them, see what works, see what doesn't. Involve the kids as well. Get kids to play with things and see what they do. A few tips on what you can do though. So if you're finding ventilation a bit tricky, so you get better flow when obviously you've got more doors and windows are open, and when they're open wider. You also get better flow when the weather's windier and blowing on the windows, and when it's colder. And I know this becomes a challenge because we don't like cold air in a room. There's different ways you can ventilate. So if you can get openings, more than one window open is a good starting point. If you can get them on different sides of the building, or different sides of the classroom with different aspects, then that can be a good start because you get this cross flow across the building. But you can also, particularly if it's a still day, if you've got windows that open at low levels and at high levels, you can do that, and you get what's called a stack effect, but it's basically hot air rises in a room. If you think of traditional sash windows, if you open at the bottom and open at the top, you get a better ventilation that happens because of it. So it's worth looking at what you've got. Even if you've got windows open on different floors of buildings, that can sometimes help. You can play tricks. You can put like a desk fan by a window blowing air out, and that can actually help circulate the air in a room and blow air out of the room better. And it's hard and cold. I mean, I realise this. There's no simple way around this. Sometimes if you open higher up windows, that can help, because then instead of the cold air coming in as a draft where you are, it comes in and mixes with the room air, and you get a better flow. You can open them intermittently, perhaps open them wider during break times and less, and then think about practicalities around uniform policy, letting kids wear thermals, letting them wear coats or fleeces or something like that, just to make life more comfortable. But I know this is really tricky at the moment, and it varies hugely. Some of you will be probably finding it's not too big a problem. Others you will be like, my classroom's freezing and it's really hard to manage. Okay, lots to talk about at the moment about air cleaners. I'm just going to briefly touch on this. So the idea here is that you're using a technology to clean the air. You basically want to reduce how many microorganisms are in the air. It doesn't ventilate a room, so it's not a substitute, and therefore you can't use it completely instead of ventilation. You still have to have some ventilation. So the air cleaner doesn't reduce the carbon dioxide in the room. It doesn't remove the gases. So that kind of, we're all a bit sleepy in the afternoon feeling, won't get rid of that one. But it will remove particles or microorganisms from the air. Loads of technologies on the market. Filter-based units, so HEPA filters or similar, are the best. They're the most reliable from the evidence that we've got. There are some units based on using ultraviolet. If it's enclosed in a box, again, they are likely to be effective. If it's some of you will have marketing from companies for all sorts of things, clever ionizer technologies, ozone generators. Don't touch the ozone generators at all. They are not a good idea. Even ionizers, there's probably not much evidence, whatever the company tells you. And all of these air cleaners, they work best if you've got a room where your ventilation is poor, or you can't get it to work properly. It's too cold or too difficult to ventilate. Those are the rooms it works best. So if you stick it in a room that's already well ventilated, it won't do any harm, but it's a marginal benefit, and therefore it might not be cost effective for you. So it's better to think about, if you're going to invest in these, or if you've got governors or parents who want to support by buying these, it's better to think about where we put them and which rooms are the poorest. And just remember, if you put one in, you're not suddenly safe. It is just another measure. It's acting just in the same way as ventilation. So what do they do? So some of the things to think about. The first thing is, and we're going to put some guidance out on this hopefully in the next week or so, but how much do you need to provide? And really, we should be assessing the ventilation in rooms to determine exactly how much, rather than just sort of guessing. But, you know, let's not let the perfect be the enemy of good. We can make some estimates, and we will try and put something out as soon as we can to help on this. But you then do have to think about, well, what device am I going to buy, and how many of them do I want? And usually you can't just have one. You usually need typically between 2 and 4 units in a classroom. That's to give you a good air distribution from them, and because they need to, they'll be too noisy if you have just one really big one. Noise is a really big consideration, so we need to make sure that they're not too noisy. And certainly if you've got children with special educational needs, there are some of them who might be very vulnerable to the noise of these devices. So there are some quiet ones. The challenge is the very quiet ones are often the least effective. So there's a kind of weird trade-off in here. You've got to think about where you're going to put them. I mean, putting 4 big devices in a room is probably not going to be very helpful for a lot of people. Do you have enough plug sockets to plug them in? Will you need an electrician to come in and do a bit of support there? Think about how robust these are. You know, you can buy a lot of cheap ones on Amazon. They might not be very good. They might be great in your living room at home. Are they going to work when they've been kicked around the classroom by some kids? Are they going to work, you know, when they're going to be spray cleaned every day? Just think about how robust something is, particularly if you want it to last more than about 6 months. Look at the capital cost, look at the maintenance cost as well. So the very cheap ones look cheap, but then you realise that they're very small, so you have to change their filters regularly, and you end up spending a fortune on filters. It's a little bit like buying printers and then discovering the printer cartridges are really expensive, more than the printer. Think about who will install them, how they get installed, and then who's going to help you, who's going to use them day to day, and what support training is needed there. They're really easy, most of these things, to use, but you do need a plan for how to do it. And then think about whether this is something that you need very short term to just manage the winter, and you've got a better solution on its way, or are you thinking, actually, well, if this comes back next winter, we'll need them again, and the next winter, and the next winter. So do we want to invest in something that's a bit more robust and longer term? Then also look at the other benefits. So some of these devices, particularly the particle filters, will also manage other pollutants. So if your school is in an area where you've got poor outdoor air quality, there might be some real other benefits there too, particularly if you've got kids who are struggling with asthma and things, kids with hay fever. There are some devices that do put substances in the air. They may be harmful. Energy use, they're pretty energy efficient, these things, possibly even more energy efficient than the heating when you've got your windows wide open in the winter. So there might be an added benefit there. We're looking at that at the moment. They might help you with being more comfortable. But I think you've got to think through these whole complexities, and it's a lot to think through. And I realise that you shouldn't be doing this. This should be done professionally. That's another difficult question. Last thing was, longer term outlook. I think COVID's highlighted that we need to think more about the indoor environments. I think that is a longer term question. We're not going to solve everything about school ventilation and indoor environments in the next 6 weeks, but I think we should be thinking, planning longer term, how we can make schools better and how we can get the evidence and the support to do that. And how we'll help try and support where we can through research and advice, but there's only so much we can do there. I have put some resources on here. I can share these slides afterwards. A few things you might want to look at. So there's a nice interactive graphic that we've put together on the British Medical Journal, which you can click on and play with and look at slide things and look at how COVID transmits. The HSE website is quite good now on ventilation. We've got lots of good tips and things in there. There's a project called CoTrace, who are a research project, but they've done some really nice videos on using CO2 monitors that might be helpful to you. And maybe this is a bit of self-promotion, but Royal Institution Christmas lectures, I did one with Jonathan Van Tam on how COVID transmits and things. And actually, if you're looking to explain the science of this to kids, particularly to try and get them to buy into why they need to wear a mask or why we need to ventilate, it might be a really good recommendation to have a look at that, because it's aimed at kids and science and that age group. So I will stop there and take questions.
That is fantastic, Kath. We've got a note from sort of Katie there saying brilliant presentation, so helpful. And I think that sort of captures it all very well. Kath, I think both of us would like to say a massive thank you to all the schools in Bradford who are actually really supporting the research, especially those schools who put their hands up and said we'll be control sort of schools within it. It really is a fantastic testimony to the wonderful community that's been sort of built up across this sort of district. And I think we can sort of say that if it weren't for that type of engagement, then it'd be very, very difficult to get the evidence that we need in this sort of a space. So huge thank you to the schools. As Kath was sort of saying, we are working really day and night to try and get some really clear guidance out that will make it much, much easier for schools, for school leaders to navigate this space. We're aware that we've asked you to become experts in virology, and now we're asking you to become experts in air sort of quality. We really sort of sympathise with sort of difficulties, so we're going to try and make life as easy as we can. I'm going to put out a call, as always, that we desperately need school leaders to help us get the messaging right. It's very easy for us to write, an article for a scientific sort of journal. It's much harder for us to translate that into easy to understand sort of instructions. So off the back of this, we will be putting out a call just to ask for a volunteer sort of panel who can help us get the wording correct, as we've done previously for other initiatives. Massive thank you. And we've got a don't stop doing this work, so Professor sort of notes. We are getting really short on time, so Kath, you don't want to stay on the line for a little bit longer. What I'll ask, if there are any questions, please do put them in the chat, and we'll come back to Kath after we've heard from Rob and John, and just try and get some answers out. So can I hand over to you now, John?
Hi, good evening. Yeah, it was. I was very pleased to hear Duncan's positive take on the COVID situation, and feeling like we're getting to the end of this, because probably this last couple of weeks have stretched us the most. But it does feel relatively normal. Although I know Martin was talking about some of the absence rates. One of my schools has had 42 members of staff off in the last couple of weeks, in which he has challenged us. And I think in schools, if you're feeling that challenge, you're feeling that strange, that's normal. Your colleagues are feeling that. We've had to put classes together, change. We've moved away from assemblies. We've changed dining arrangements for schools, and we've had to send the year groups home. I've had to send a couple home for next week. They don't know it yet, but I suppose everything this time is shorter. We're prepared. We've got the learning ready to go. We're bringing them back in. We're having those communications with families, and everything's shorter. So hopefully the impact's not going to be felt, but we're trying every sort of strategy possible to keep them in school at the moment and keep working on it. And I suppose if you're out there, we're all feeling the same pressure, and hopefully we get to the back end of this and it becomes a lot easier. So that's sort of what we're doing in our two schools. We're seeing more understanding from parents around some of those decision making, although we have had a couple of strange gentlemen turn up at schools complaining about closures that are nothing related to school. So we've reported that with our local police, so we've just been mindful of that across our schools. But keep doing what you're doing. It's a tough period, but we'll get through it.
Excellent, thanks, John. It's good to hear from you. Rob, how are things looking from your neck of the woods?
Okay, I can just echo what everyone else is saying and what John was saying, but I do feel reassured to hear what Duncan was saying about heading into the home straight. Again, it does feel like that, and I was speaking to a fellow head this morning saying that there is a sense of hope in the air as well. So hopefully we're kind of moving towards that. I think also, you know, it's really interesting to hear about the key role of ventilation in all of this, because you're worrying all the time about whether you're doing the right thing, whether your cleaning is enhanced enough for the situation. But I've no words of wisdom to provide this evening, only to say that, again, it's been such a fast-moving picture in my school over the last 2 weeks. And I think that increase in LFDs has completely changed the way in which we're having to administer and respond to cases in our school. And I think we are having to kind of think on our feet again about how we respond. And it's made it much more difficult to make decisions about what to do in terms of whether we kind of move to more of a bubble system, what activities we restrict in school and so on. But I think that work that we did before Christmas on our contingency planning and making sure that we had that in place has been really useful. And I think from our perspective, we are mostly working in our contingency and then kind of sliding between other things. So, for example, we have a setup on a Friday afternoon whereby a lot our children mix right across school. So we're having to kind of assess that each week to decide whether or not that can go ahead. So, for example, tomorrow our Key Stage 1 children aren't mixing, but our Key Stage 2 are, because we don't have that many cases in Key Stage 2. We have many more in Key Stage 1. And I think it is having to be really light on our feet at the moment. So hopefully we can move forward in a positive way. But I think from our perspective, and again, I think this is reflected by talking to other heads locally, we are so determined here now that we continue to focus on teaching and learning as much as possible, and that COVID sits in the background. And I really hope that we can continue to do that over the coming weeks, because that's our core purpose, and that's what we've got to focus on for the next few weeks. So that's all I've got to say right now, but hopefully that's a little insight into life at Saltaire Primary right now.
Fantastic, thanks Rob, as always. So not too many questions for Kath. I'm just going to take this opportunity to give a big plug. February 3rd, we're going to have a big webinar, really important webinar. We're going to be laying out sort of our plans that we have for the district, that we've been co-producing with the Department for Education, with the opportunity area, bringing health services, looking at providing much better support to schools for all of those factors that are happening outside the school gates. And one of the big parts of working on that will be working with schools to see how we can improve sort of our ventilation and the like. So really exciting plans, so please do sign up for the February 3rd webinar. Kath, we just got a couple of questions here about best way to make a plan to apply for funding, and about participating in research, and then another question about inadequate carbon dioxide monitor supply. Could you handle those?
Yeah, so best way to make a plan if you feel like your school doesn't have good enough ventilation and you want to apply for DFE funding, because I know there is some available for things. I think it's about making sure you've got some evidence that your ventilation's not effective and that you've done some stuff. So I think start by, if you've got some CO2 monitors, record what CO2 levels you're seeing and record how often you're seeing them and the duration of time that you're seeing them for, but also record, you know, the size of the classroom, what your ventilation is like, you know, have you opened the windows, has it got a ventilation system, what's in there at the moment, and how many people are in there, because I think you need that context for that measurement to make sense. And then I think, you know, it is difficult. It would be great if there was a facility for somebody to get professional advice in. The reality is there isn't funding for that at the moment, as for my knowledge. It may be that some schools have access to, through parents or whatever, to people with expertise who can take a look, but there isn't really a capacity at the moment for people to come in and assess your ventilation unless you go to an outside company, you know, an engineering company, a ventilation company who can do that. So there are some companies who can do it, but I don't think there are that many out there who are actively doing this at the moment, and many of them have a big backlog because, you know, you imagine not just schools, but every workplace in the country is asking the same questions at the moment. Participating in research. at the moment, the lead stuff is perhaps there's not so much we can do directly in terms of measurements and things, but as Mark mentioned, you know, we'll be seeking advice from people about feeding into guidance and things, so there might be opportunities to feed in there too. CO2 monitor supply, yes, not perfect. I think DFE rolled out 1 per 2 classrooms. Obviously, you could buy additional ones. You could perhaps try and fundraise through PTAs and things to get additional ones if you're finding them useful. Obviously, don't spend money on something that is not helping you. What I would do to start with is maybe, you know, put it in one classroom for 2 or 3 days. Try and use it to get a feel for what to do in that classroom, then move it to another classroom for 2 or 3 days and get a feel for that as well. I know it feels like a bit of effort, but sometimes, you know, actually you can learn quite quickly what makes a room work. You might even want to take them home at the weekend and play with your house and see what happens and play with ventilation. Maybe, I don't know, some people like, I just love ventilation, so maybe it's just one of those things. But it is that kind of, you get a feel for what works and when. You get a feel for the weather conditions that make ventilation harder and the weather conditions that make it easier. We know it instinctively to some extent anyway. You know that if it's really windy, all the doors bang in the building, that's telling you it's being ventilated, because that wind is moving those doors. You get hot, still summer days where you open the windows and absolutely nothing happens. It's not ventilating very well on those days. You need a fan to make ventilation work on those days. So it's, you know, I'd love to say ventilation is really easy. It's just sadly not. But try and play with it and don't be frightened of it. They're not, you know, don't be worried, you know, if it goes over a certain value, don't go, oh my God, it's gone over this value, we're not safe. It's not a threshold, it's a guide, and use it as a guide, learn what the environment does as best you can.
Brilliant. Thanks, Kath. And again, just to say, we will do our very best to capture all of Kath's wisdom and the wisdom of the fantastic colleagues that we are working with throughout the UK on these sort of topics. So we will make that available, but we'd love your input to make sure that it's as useful as it possibly can be. Again, plug for that February 3rd webinar, please do sign up. And then finally, a sort of a plug. So you know, these webinars are all about us working together across our different disciplines with a researcher, school leader, a public health sort of a consultant, sort of pediatrician, all the like. It's all about working together to give the best possible sort of support to children and young people within our communities. And we like to really use these webinars to drive action. One thing that came out of last year was that school staff wellbeing support sort of our service. In this sort of a chat, there's information about it that's still available for sort of staff. We're still going to do our best to try and support everybody's social and emotional well-being as we go through these difficult sort of times. More on all of this on February the 3rd, but if I can right now just say a massive thank you to our sort of our colleagues, Duncan and Martin, to Kath, to John, and Rob for the fantastic insights as always. Thank you to everybody for coming along and for working together to try and mitigate these responses and give the next generation the best possible start in life we can. Thank you all. Hope to see lots of people on February the 3rd. We will circulate all the materials as always. Do get in contact if there's anything we can help with. Thank you. Goodbye.